Are you having pain in the neck that is radiating down your arms into your hand, or numbness and tingling in your fingers? Are you having back pain that goes down your legs that may be keeping you from doing the things you want to do, playing golf or enjoying time with your kids or grandkids? I'm Dr. Craig Strickland at Carolina Rehab and Physical Medicine Center here in Little River, South Carolina. I'd like to talk to you about a new non-surgical approach to spinal decompression. Patients tell us all the time they know they have disc herniations, issues with their neck and low back that are going into their arms, their hands, their legs, or their feet, pain, numbness, tingling that is keeping them from their daily lives, and they want to do something about it, but they're scared to death that their only option is surgery. That is no longer the case. We have a non-surgical approach with our FDA cleared decompression table that we have been getting phenomenal results with. Today, I'm excited to show you our new state-of-the-art decompression table. This is the Accu-SPINA. It is one of the very few FDA cleared non-surgical decompression tables. We use it for neck disc herniations and lumbar or low back disc herniations. The biggest issue that we see with patients that would utilize this table would be pain that goes into the arm or down to the hand, or numbness and tingling that goes into the hand, or pain in the low back that goes down the leg, sciatica, or numbness and tingling into the leg or feet. These treatments are relatively short. They're painless. In fact, most of the time, our patients fall asleep when they're in the middle of their session. A typical treatment protocol would be about 25-26 minutes on the table. We would do that a few times a week initially, and as people go and get better, that oftentimes will decrease in frequency. So this is a model of our low back. These are bones. This is a disc, which is very similar to a jelly donut. In this situation, the jelly or herniation can get pushed out of the back and it presses on the nerve. This compression is what causes your pain down the arm or down the leg, or the numbness or tingling into the arm or hand or leg or feet. Our approach is to put you on the decompression table and pull you, and in doing so we decrease the pressure and create a suction in the disc that literally pulls the herniation back in and stops the compression of the nerve root. Multiple studies done at Harvard University using this very table have shown that the success rate is 86 to 92%. Compare that with some more invasive surgical options, they are about 47% effective. A lot of our patients are elderly and they're very concerned with some of the medications they take and other things, their health. They're very concerned about going under anesthesia. This is a great option for addressing the symptoms of disc herniation without having to go through some of those more fearful situations of anesthesia or surgery. This is a great place at the very least to start. With that being said, let's take a look at how the table actually works. For a low back patient, the table separates, increasing the amount of pressure that is being put on the low back and the disc. That's how we make that change. All of our patients talk about how surprisingly comfortable the procedure is. As I've mentioned, most of the time patients fall asleep or they're on their phone handling business or playing video games, but they do very, very well with that. Whenever we're addressing the neck herniations that are causing issues into the arms or hands, the patient lays here with their head here, and there's a gentle traction pressure that is generated this way, which helps to reduce the symptoms that they're having with the disc herniation. What this table actually is doing is it is tractioning the spine and creating space so that those nerves are not being pinched or choked by that disc herniation, relieving the pain or symptoms, numbness and tingling that are going down the legs or down the arms and into the hands. So as we're going through this decompression treatment, we cycle high hold and low hold, and in between those, at our high hold, we oscillate. So this graph of blue is what we expect the treatment to do. This particular patient, we're pulling him about half his body weight, and we're right here. This is for a low back protocol. This really is where the magic happens. these oscillation points. That's how we kind of pull the disc to tension, and then we oscillate it, which is where we start to really change the herniation there. Treatment plans vary based on the severity of the case, so it's very important that you bring in your MRI results when you come in. If you don't have MRIs, that's okay. We can certainly order them for you. Let's take a look at some of the results that we've been getting with this Accu-SPINA decompression table.
I went through a plethora of therapies to try to get myself back on my feet, including epidural steroid injections. I had heavy medicines, 9 weeks of physical therapy. Nothing was working. You laid out a process plan that involved disc decompression therapy. We stuck to that. I'm much better today in 3 months working with you. The way that you listened to me and didn't rush me to give you all of the history that I had, I was very impressed by that. Nobody in the medical industry has done that and spent that much time trying to understand all the things that were going on with me.
So when I first started, I was in so much pain. I mean, literally, I had almost given up my yoga. I wasn't doing any gardening. I wasn't active. I was just in pain all the time. Over the 60 years, with a bad back, I've had multiple treatments. I've had chiropractic care for 40 years, but I'd never done decompression. And so I was very intrigued by it. Very relaxing treatment, no pain whatsoever. And I am like a different person. I mean, you could ask my husband. I don't have the chronic pain that I was in before we started the decompression treatment. So worth every dime of that treatment and time.
Yeah, I had a herniated disc and it was excruciating. So when I came here, I didn't know if it was going to go more surgery or could it be treated with chiropractic treatment. And you helped me to understand surgery can be completely avoided, which was a big relief to me. And really, within just a few treatments, I had a huge amount of relief. And then within just a few weeks, it's almost like it never happened.
As you can see, our patients have been getting life-changing results with this non-surgical spinal decompression. If you are having issues with your neck pain or low back pain that is radiating or traveling out into your arms or hands, legs or feet, or numbness or tingling, things that are impacting your daily life, things that you want to try to be rid of, please contact us right away. We will set up a consultation at no charge to see if you're a candidate for this amazing new therapy. You deserve to be able to live your life with less pain, be able to do the things that you want to do, playing golf, playing with your children or grandchildren, enjoying walks on the beach, being able to sit through some of the shows that we have here. You owe it to yourself to have the opportunity to live a pain-free life. I'm Dr. Craig Strickland at Carolina Rehab and Physical Medicine Center in Little River, South Carolina. Give us a call today.